In this lecture, I will be discussing urticaria. Let's discuss what urticaria is. So urticaria is commonly referred to as hives and is known as a type 1 hypersensitivity reaction. The common cause of hypersensitivity results from an allergic reaction to something that is being ingested or by direct contact. The two types of urticaria are immunological or non-immunological. Immunological urticaria is caused by an immune response to an antigen. Non-immunological urticaria or contact urticaria is occurring when the immune system has not been exposed to an allergen and has not produced antibodies against that foreign substance. So acute urticaria lasts less than 6 weeks, whereas chronic urticaria lasts more than 6 weeks. The immune system is good at detecting foreign substances and cells, and it has a highly sophisticated way of protecting the host. So if the immune system recognizes a foreign substance, it will produce a response and put that information into memory cells when future exposures occur. The immune system is always on guard and monitoring for outside invaders that can cause harm to the body. So initial exposure is what is producing the antibodies to specific antigens, making the immune system useful in fighting future exposures. The body can have what is called a hypersensitivity reaction, whereas the allergic response is then becoming either mild, moderate, or severe, and can eventually be fatal if it turns into anaphylaxis. Urticaria is very common in men, women, and children. However, it's not very easily understood. Based on research, it affects more than 500,000 people annually. And as far as chronic urticaria, it is more prevalent in white women over the age of 40. But again, anyone can be affected by this at any time. So let's jump into the pathophysiology of urticaria. The immune system is very complex and it does play a huge role in protecting the host from internal and external substances that can be harmful. So in a type 1 hypersensitivity reaction, when a B cell is exposed to an antigen, it will activate and become a plasma cell, and it will then gain the ability to produce antibodies. The lymphatic system will carry the B cells around as memory cells as part of adaptive immunity. When the body is exposed to the allergen again for the second time, the IgE antibodies from the B lymphocytes will attach to the mast cells. Now, mast cells are found in very large quantities all throughout the body, especially in the digestive tract and the respiratory tract, and they're considered to be connective tissue. So when the mast cells attaching to the IgE antibody, it is sending out what is called granules. So this process is called degranulation, and when the mast cells activated by the foreign antigen, the substances will be released into the lymphatic system. The mast cell is releasing these chemical mediators, for example, histamine, kinines, prostaglandins, leukotrienes, cytokines, and tumor necrosis factor alpha. These chemical mediators are creating the vasodilation and angioedema that is typically presenting when a patient has urticaria. So once the chemical mediators are released into the system, they have the ability to attach to certain receptors in smooth muscle, such as H1 receptors, H2 receptors, or H4 receptors. So some of these receptors are found in the lungs, some are found in the GI tract, and some are found in the nerve fibers in the central nervous system. So when these chemical mediators are attaching to the H1, 2, or 4 receptors, different reactions can occur. Vasoconstriction can occur in smooth muscle in the lungs, which is creating that sensation of inability to breathe, or feeling short of breath, or feeling like their throat might close up. Sometimes they can feel itchy. If the chemical mediators are attaching to the nerve fibers in the central nervous system, or sometimes they can feel GI symptoms like nausea, vomiting, if the mediators are attaching to the receptors in the GI tract. So now that we've kind of discussed the pathophysiology of urticaria, let's discuss the risk factors. And let's explain how they contribute to the disease. So there are various risk factors, that can potentiate urticaria. Acute urticaria is more prevalent based on studies in areas where there's a highly dense population, and as well as a population of people who are genetically predisposed to allergies according to their family history. Genetic predisposition plays a role. By the way, genes are responsible for genetic autoimmune diseases and causing chronic urticaria. There are certain genes that play a role in basophilia and eosinophilia as well, and they also can contribute to the disease. Risk factors also include autoimmune diseases such as rheumatoid arthritis or systemic lupus erythematosus, or SLE, which, these patients typically have flare-ups of urticaria based on their genetic predisposition. Environmental factors play a role, such as exposure to allergens or cold exposure. Also, there are different clinical variations of urticaria, so they can develop based on different mechanisms. Certain allergens, such as food or insects or medications, or exposures to vaccines, can also be a risk factor, as well as viral and bacterial infections as well. So major signs and symptoms of urticaria include erythema, local hives, local wheals, raised bumps. This will be notable on clinical presentation. Also, symptoms include itching that can be mild or severe, dry, tight skin, swollen lips, angioedema, and we do need to be careful with systemic type 1 hypersensitivity reactions, because if anaphylaxis occurs, it can be fatal. And as far as diagnostic testing is concerned with urticaria, clinical assessment is useful in diagnosing acute versus chronic urticaria when patients have visible wheals and they disappear within 24 hours of presenting. Also, certain skin prick testings, alloabsorbent tests, immunofluorescent tests, CBC with diff to see what kind of immunoglobulins are in the circulatory system, as well as a CRP, which is an inflammatory marker, to basically see, how severe the systemic reaction is based on what is causing the urticaria. And lastly, an autologous serum skin test can also be helpful in determining what is causing this hypersensitivity reaction. Well, that's the end of my presentation, so I thank you if you've made it this far, and I wish you the best of luck. Thank you. I have attached this slide to present my references for this topic. Thank you so much.